Hi, my name is Ian Chow, and I'm a resident at the University of Pittsburgh Medical Center. I will be presenting a paper on optimizing carpometacarpal arthroplasty of the thumb. So some background, the thumb CMC or carpometacarpal joint is the most common site of osteoarthritis in the upper extremity, with a prevalence of 25% in women and 8% in men aged 50 to 65. And although all surgical techniques involve removing the trapezium, it is unknown which surgical technique of resuspending the thumb metacarpal is most efficacious. The classic approach is ligament reconstruction and tendon interposition, which involves harvesting a split FCR graft in order to maintain the trapezial space by reconstructing the palmar oblique ligament. A newer technique is suture suspension, which involves preservation of the FCR and presumably wrist flexion strength, and involves creating a sling using the FCR to the APL. So the aim of our study was to perform a prospective cohort study looking at outcomes in LRTI and suture suspension techniques of CMC arthroplasty. And in this initial phase, we enrolled 24 consecutive patients who underwent CMC arthroplasty by 4 surgeons, where 2 performed LRTI and 2 performed suture suspension. In terms of outcomes, we looked at radiographic outcomes, which included thumb metacarpal subsidence, physical exam, including abduction, extension, opposition, grip, and pinch strength, functionality, which included measures on the brief Michigan Hand Questionnaire and the DASH score, as well as pain, which was the visual log analog scale. So in terms of results in range of motion, LRTI reduced abduction from baseline to 6 weeks, and there was less abduction compared to suture suspension at 6 weeks. In terms of extension, there were no significant differences between groups or time points at either baseline at 6 weeks or between surgical groups. In terms of opposition, LRTI significantly limited opposition at 6 weeks relative to suture suspension. There were no differences between groups or time points in terms of pinch strength or grip strength. And both techniques resulted in less pain 6 weeks after surgery compared to baseline, and there were no significant differences between techniques in terms of pain level. And in terms of radiographic maintenance of the trapezial space, both techniques resulted in thumb metacarpal subsidence, but the trapezial space was better preserved with the suture suspension technique at 6 weeks. In terms of functional outcomes, there were no significant differences between the techniques in DASH score or between the preoperative and 6-week post-procedure time point, but there was improved functionality at 6 weeks with both techniques in the Michigan Hand Questionnaire, and there were no significant differences between each of these techniques. So in conclusion, both LRTI and suture suspension CMC arthroplasty improved pain and functionality, and both result in subsidence of the thumb base, but there's comparatively less with suture suspension. And then the early postoperative outcomes seem to favor suture suspension in terms of range of motion and strength, but will require longer follow-up in order to determine any definitive factors about this. So moving on in terms of future directions, the goal is to enroll 60 patients with longer-term follow-up of 6 months in order to get an adequate idea of long-term outcomes in terms of range of motion and strength. And if anyone has any questions, they can reach out to me at this email address. Thank you.